So I want to just, in a calm way, provide you with an image of what this bill represents. It acknowledges that this state continues to care about children's health. It acknowledges that we have new ways of administering federal programs. It acknowledges a reduction in FTEs and staff that have direct services to our citizens in every part of the state. It means services will be slower, some services will not be accessible, and some people will be hurt by it. But it also means, and it's an acknowledgement, that we have members of this state government that will not work 40 hours a week to fill the gaps. They will work 50 hours. They will work on weekends. We have providers, nonprofit organizations, that will open up their doors and include more people into their facility and provide services that they won't get reimbursed for, because their job is not to look at our budget. Their job is to provide the services. And in this state, we have providers that will do that. We have hospitals that will continue to provide free care, not because it's a federal law, because they know that they're committed to doing that in their community. We will have doctors, nurses, pharmacists that will go out of their way. But you know, you can't ask them to do that forever. At a time when we have higher unemployment, we have more parents working two-income jobs, we have more children staying home alone. We should provide the services so that parents feel the security that they can get daycare for their kids. They can get quality care for their children. We're not providing that. Ladies and gentlemen, this is not like a transportation bill where we're worried about contractors paving another mile of road. This is about families staying together. This is about people who believe that government is there to help them. And when they say government, I don't mean state government or even local government. They see their Irely Ball mental health system as a public service. They see that as government because we fund it and they're publicly oriented. They see their community centers as government because that's what they know. You see it as bureaucrats. People see it as wasted money, duplication of services. But that's not what Iowans see it as. When a wife and a husband are rushing home to their house after work, knowing that their children are there alone, has consequences. Or letting a neighbor take care of their children who they don't really know that well, but it's convenient, has consequences. So this bill is not our best effort. We don't have much time to correct it. We can do better. I want you to know that even though there are statements made throughout this year about any one of these programs that we have in this bill, from family planning to mental health, we all have our opinion. But in the end, I'm asking you to work harder to make this a better bill.